Welcome to the deep dive. Today, we're looking into something a bit insidious, really, a hidden danger that could be in freshwater spots, maybe even your own backyard pond. Blue-green algae toxicosis.
That's right.
We've gathered quite a bit of information pulled from various sources on this topic, and our mission really is to break it down, what you need to know about these blooms, the threats they pose, especially to animals, and, well, how to keep them safe.
And it starts with a bit of a curveball, doesn't it?
It does. The name itself, blue-green algae, it's misleading. These are actually cyanobacteria.
Exactly. Bacteria, not true algae.
And we'll be digging into the two main ways they cause trouble. Hepatotoxicity, which attacks the liver, and neurotoxicity, which affects the nervous system.
Okay, let's get into it.
So where do these things actually pop up?
Well, they're pretty widespread. You find them in fresh water, sometimes brackish water,
Yeah.
and worryingly, they can get really concentrated in places like backyard ponds, especially if the water's stagnant.
Right, stagnant water. And what makes them bloom like that?
It's usually a mix of things. Think nutrient-rich runoff, maybe fertilizers washing, combined with warmer water temperatures and, like you said, still water. Those are kind of the perfect conditions.
So it's not just a pond looking a bit green, it's these specific conditions making the cyanobacteria multiply and potentially produce toxins.
Precisely. And that's the danger. Exposure can lead to really acute poisoning, hitting either the liver or the nervous system. And this isn't just animals. Humans can be affected too, though our focus today is mostly animals.
Yeah, particularly our pets.
Mhm.
And the info suggests one type of poisoning is seen more often.
It does. Hepatotoxic poisonings, the liver ones, they seem to be reported more frequently in animals.
Okay. Are there specific types of these cyanobacteria we should know about?
Yes. The sources mention several genera known for producing toxins. Names like Microcystis, Anabina, Aphanizomenon, Oscillatoria, also Lingbia, and Planktothrix species. Quite a few, really.
And the toxins themselves.
Two main groups. For the liver, it's primarily microsystems. These are found pretty much worldwide. Then for the nervous system, you have anatoxins, specifically anatoxin and anatoxin as.
Got it. Microcystins for liver, anatoxins for nerves. So let's talk impact. What happens if, say, a dog encounters these? Does breed or age matter?
Interestingly, no. The information suggests there's no specific breed, sex, or age predisposition in dogs. It can affect any dog.
And cats.
It's curious, but our sources mention no reported cases in cats. It seems dogs are, for whatever reason, the primary concern among common household pets.
Okay, so for dogs then, what are the signs if it's the liver, the hepatotoxic kind?
You might see things like diarrhea, just general weakness, maybe signs of shock. And the really worrying part is how fast it can progress to depression, coma, and unfortunately death.
Sounds incredibly rapid.
It is. And the neurotoxic form can be even faster. We're talking onset within minutes to maybe a few hours after they've been exposed.
Minutes. Wow, what does that look like?
You might see initial rigidity, muscle tremors, and that can quickly escalate to paralysis, cyanosis. That's where the gums might look bluish from lack of oxygen and, again, potentially death. It's very, very serious.
This really hammers home why understanding exposure is so vital. The main route is obviously drinking contaminated water or ingesting the algal scum itself, right?
Yes, direct access and ingestion is the primary cause, but it's not just about drinking.
How so?
Well, these blooms are more common in nutrient-rich water, especially during warmer months. But also, think about wind. It can push and concentrate these blooms along a shoreline.
Ah, so one part of a lake could be much worse than another.
Exactly. And even if someone tries to, say, scoop the algae out of a pond and leaves it in a pile, that concentrated material is still highly toxic if an animal gets into it.
And there was something else mentioned, something about the sediment.
Yes, that's a really important point. Some of these cyanobacteria live down in the sediment, the benthic zone.
So not just floating on top.
Right. Which means a dog that likes to, pick up or mouth rocks or sticks from the bottom of a stream or pond could ingest toxins, even if the water surface looks clear.
That's a hidden danger. Makes you realize you can't just judge by the surface scum.
It really underscores the need for caution around any fresh water, especially with pets.
Okay, let's shift to diagnosis. If you suspect exposure, what are vets looking for? The sources mention differential diagnoses. What does that mean in this context?
Basically, it means ruling out other things that could cause similar symptoms. For the liver signs, the hepatotoxic ones, a vet has to consider other poisons, like xylitol.
The artificial sweetener?
Yeah, found in sugar-free gum and stuff. Also, certain plants like sago palms or even medications like high doses of acetaminophen. plus other causes of acute liver failure.
Okay, so the symptoms overlap with other conditions. What about the neurotoxic signs?
Similar idea. Things like strychnine poisoning, exposure to certain insecticides, or even some toxic plants can cause neurological symptoms that look like antitoxin poisoning.
Mm,
So getting good history of exposure is key, but the vet has to consider these other possibilities too.
makes sense. So what about lab tests? If it is hepatotoxic poisoning, what might show up in blood work?
You typically see significantly elevated liver enzymes. Vets look at markers like ALT, AST, ALP, bilirubin. High levels suggest liver cell damage. They might also see low albumin, which is a protein the liver makes, and potentially low blood sugar, hypoglycemia.
And for the neurotoxic type, is there a blood test for that?
Generally, no. Our sources say that routine blood or urine tests don't usually show specific changes with antitoxin poisoning. Diagnosis often relies more heavily on the clinical signs, the rapid onset, and any known history of exposure to suspicious water.
So confirming it is tricky. How do vets try to confirm it's blue-green algae?
Well, one way is microscopic identification. They can look at samples of the water, the scum itself, or even what's in the animal's stomach to see if cyanobacteria are present.
But you said earlier, just seeing them doesn't mean they're toxic.
Exactly. It confirms exposure to the algae, but not necessarily to the toxins. Some strains are toxic, others aren't.
Right. So how do they test for the actual toxins?
There are specific lab tests. For suspected liver toxicity, they can look for algal material on the fur or in stomach contents. More definitively, they can send stomach contents and, importantly, the water or algal source itself to a specialized lab to test for microcystins.
And for the neurotoxins?
Similar process. They can test gastric contents, urine, bile, and the source material for antitoxina. And for antitoxinous poisoning, there's a specific clue. They might find depressed activity of an enzyme called blood cholinesterase.
Okay. And grim question, but what about after an animal passes? What might an autopsy and necropsy show?
With hepatotoxic cases, you'd likely find algae on the fur or in the stomach. The liver might look enlarged. And microscopically, you'd see evidence of liver cell death, necrosis, and hemorrhage.
Pretty clear signs of liver damage.
Yes. But with the neurotoxic form, while they might find bloom material in the gut or on the legs showing exposure, there often isn't any obvious gross tissue damage visible. It really highlights how these toxins work primarily on the nervous system very quickly.
It paints a very serious picture. So, treatment. What can actually be done if an animal is poisoned?
This is the really tough part. The sources are quite clear. There is no specific antidote for either microcystin or antitoxin poisoning.
No magic bullet.
No. And because things happen so fast, especially with the neurotoxins, getting any treatment started effectively and in time is, well, extremely challenging.
But there must be some supportive measures vets try. I think the info mentioned activated charcoal.
Yes, that's often a first step if ingestion is known or strongly suspected, and it happened recently. The idea is the charcoal binds any toxins still in the stomach or intestines to prevent absorption.
Does it work well?
Its effectiveness for cyanotoxins specifically isn't definitively proven, but it's a standard decontamination procedure. It probably doesn't hurt and might help if given very early.
Okay. And beyond that, for the liver cases, what's the focus?
It's all about supportive care. Aggressive intravenous fluids are crucial to maintain hydration, support blood pressure, and help flush the system. They'll also manage electrolytes and give dextrose if blood sugar is low. Sometimes vitamin K1 is given because the liver damage can affect blood clotting, and in severe cases, blood or plasma transfusions might be needed.
And for the neurotoxic cases where the nervous system is hit so hard,
There, the supportive care focuses on controlling the neurological signs. So, medications to control seizures, like diazepam or phenobarbital. Muscle relaxants, like methocarbamol, might be used for the tremors and rigidity. If breathing is failing, mechanical ventilation might be required, but that's often intensive care level stuff.
I saw mentions of some experimental or maybe less proven treatments, things like SAMe, vitamin C, cimetidine, and acetylcysteine.
Yes, those are sometimes used for general liver support or as antioxidants in other toxicities. However, the sources emphasize there's really a lack of solid data showing they're specifically effective against cyanotoxin poisoning in animals. So while a vet might try them as part of overall support, they aren't considered cures.
This all circles back quite strongly to prevention, doesn't it?
Absolutely. Given the lack of an antidote and the speed of progression, prevention is, without a doubt, the most critical factor.
And the key advice there is pretty straightforward.
It is. The number one thing is deny access. Don't let your animals swim in, drink from, or even walk near water with visible algal blooms or surface scum. If it looks suspect, stay away.
What if it's your own pond?
If you see a bloom forming in a backyard pond or trough, remove it immediately. Carefully scoop it out and dispose of the material safely where animals absolutely cannot get to it. Don't just leave it on the bank.
Right. Even if an animal survives the initial poisoning, are there potential long-term problems?
Yes, there can be complications. With the liver form, even if they pull through the acute phase, they could develop chronic liver issues or hepatic encephalopathy and neurological problems due to the liver not functioning properly. DIC, that blood clotting disorder, is also a risk.
And for the neurotoxic survivors?
DIC is also a potential complication there. Another serious one is rhabdomyolysis, that's severe muscle breakdown.
Muscle breakdown, why does that happen?
It can be triggered by the intense muscle contractions or seizures. This releases myoglobin from the muscles into the bloodstream.
And that's bad.
Yes, it leads to myoglobinuria, myoglobin in the urine, which can cause severe kidney damage, potentially acute kidney failure.
So even surviving the initial event doesn't guarantee a full recovery. What's the general prognosis then?
Honestly, it's typically considered poor to guarded. The rapid onset and progression just make it incredibly difficult to manage successfully. Many cases, unfortunately, are fatal despite veterinary efforts.
So wrapping this up, the single most crucial takeaway for everyone listening has to be prevention. Avoid letting your animals near water with visible algal blooms. Full stop.
Exactly. The speed and severity just leave very little room for error. There's often no time for effective treatment, and as we've said, no specific antidote exists.
Vigilance is key.
It truly is. Being aware of water conditions, especially during warmer weather or in areas known for nutrient runoff, is the best defense you have to protect your animals.
Okay, on that sobering but vital note, let's leave you with a final thought. Given what we know about nutrient runoff and rising temperatures potentially fueling these blooms, maybe take a moment to consider your local environment. Are these blooms becoming more common? Are there local resources or alerts about water quality you could follow? Thinking proactively about this might just save an animal's life. Thanks for joining us on the Deep Dive.